Like Diana was saying, we were trialing. These are the hover mats. They're single patient use disposable mats that are used to help laterally transfer your patients. And ideally, we're going to have this underneath, patients in the OR, and it would travel underneath them, throughout their length of stay. The mats do come in different sizes. This one right here is a 34-inch mat. We also have a 39. They all have a 1,200-pound weight capacity, so you just need to have a mat that's wide enough to accommodate the width of your patient. It is a disposable, so it's white here. Just remember the feet, the little footprint right here just needs to be facing up. As you can see at the foot end is where the air supply inserts, just like the air pal or even the other reusable hover mat inserts. We have these handles here that you can be used for your transfers and when you're repositioning your patients. And then these right here are safety straps that should be buckled around your patient when you're doing a lateral transfer. We always recommend to just keep a regular, just flat sheet between the patient and the mat, just so their skin isn't directly on this. And for example, like in the ICU, put a pair of chucks over the top just to keep it clean, since it is a disposable, that you want to keep this as clean as possible. So just a sheet and then chucks as needed. This right here is our air supply. We have 10 currently in the hospital right now for that trial. It's a little bit different from the other air supplies that you might have seen in the past. The other ones just were the on-off button. This one actually has 4 buttons. We have an adjustable, which is a gradual inflation, so you can slowly inflate the mat underneath your patients. Standby just turns off the air. And then we have 2 different buttons. One right is here for the 34-inch mat. There's a little 34 right there for it, and then 39, it's a little bit more airflow for that extra material of the mat. It does need to be plugged into an outlet, and just insert the air supply at the foot end of the mat, just like you do for the other pieces of equipment, or for the other mats. And then just make sure that you snap that in there, just so when you turn it on, the air supply doesn't come out the foot end of the mat. And then just put that right over. And so since it is a disposable, they aren't meant to be laundered, however. You can use a cavi wipe to clean up if you do get any kind of a spill on it, but otherwise they're not meant to be laundered. And if I could just have someone just hop up here to be a patient. So you can see. Perfect. So, and it's key to make sure that your patients are centered on the mat. So just make sure that they're not too far off to one side. If they're off, too far, when it inflates, they'll start rolling. And then always make sure that you leave about 1 to 2 inches from the top of the head of your patient to the end of the mat, so that when it's inflated, it gains a few inches and that their head is supported. So just snap these on. And this is what it looks like for the adjustable inflation. Every time you want the air actually to increase, like in the speed, you have to press the button again. But this is nice for like patients in pain, so it's a nice slow inflation, or if anyone has a little bit of anxiety with this and might be nervous with this, it just kind of gradually introduces them to the sound and the feel of this. Then you just, and if I could just have someone just on the other side, we always recommend putting the feet over first. Well, as you can see, and it was pretty comfortable for you, right?
Yeah.
Basically, like, it eliminates all the skin shear and pulling over the sheets, and all of the friction is underneath. So. And that's pretty much it. So if you were using it to boost a patient, all you would do is hook up this air supply. Make sure that the bed is flat. If you're boosting, and just pull them up. But as you could see, it's real simple and easy to use to move your patient. These are radiolucent, MRI compatible, and they can be used in CT as well. So during the trial, I don't think any of the patients ended up going over to any of the imaging department, but you can use this to transfer your patient onto one of those tables, deflate it, and then shoot all of your images, and then transfer them back over. And you can use these to help insert the film underneath the patient. If they're in a bed on the floor, you just insert the air supply, inflate it. You can put the film between the bed and the mat. Turn off the air. Make sure all the air is out, and then you can shoot your image, inflate it to get that film off. Well, the product. This is the Hovermatt. Yep. And I know I said that we have the two different widths, the 34 and the 39. You can just find those, or the width is right here on the label. It just says model number. This one is HM34 SPU, and the 34 has red handles. The 39-inch have green handles. So after using it a little bit more often, you just get familiar with the colors.
So you're giving them to every patient in the OR, or just certain patient population?
Just a certain patient criteria that...
Is it weight related?
Well, right now I think that still is trying to be established. Talking to Carrie, I know that she had said you're kind of working on that, correct?
Right. Well, eventually, I think we'd like to have it with every patient. And I think there's also use in birth suites, right?
Yep. Yeah, the birthing suites are using it. So after a C-section, they don't have it on the table during the case, but then after they'll have it on the cart so that when they bring the mother back to her room, they'll use it to transfer them onto their cart. But those are reusables.
How do you dispose of those?
Just like a regular, you would just toss them out in your regular.
Are they biodegradable or?
It's eventually, everything, yeah, they're not like green or recyclable or reused.